We'll take a look at page 1. All right, so I'm just going to start to throw some stuff at you, and some of you may know some of this stuff already, and some of you don't, and that's okay. This is exactly the kind of stuff we're going to be learning about here for the next few weeks. So in the year 2004, these were the top 10 drugs that were prescribed. We're not talking about over-the-counter drugs, but prescription drugs. And basically, this list hasn't changed much. We'll give you some even newer lists in just a moment. But you'll notice the #1 most prescribed drug was hydrocodone with APAP, which is a generic. Now, the question is, what is hydrocodone with APAP? And anybody know who? Somebody said? What is it? It is Vicodin, or Lortab. So Vicodin is a brand name, and Lortab is another. And those are just registered brand names for hydrocodone with APAP. Now, what is hydrocodone? Hydrocodone is a narcotic pain reliever. Even sounds kind of like codeine. And so it's a narcotic. And the question is, what is APAP? Anybody know what APAP is? APAP is the way they commonly, really generally refer to Tylenol. Tylenol, which is a registered brand name for, anybody know what the generic name of Tylenol is? Acetaminophen. But the chemical name for acetaminophen, don't worry about writing this down, the chemical name is acetylparaminophenol. And so the abbreviation for acetylparaminophenol is APAP. Here, the second most prescribed drug, and it's been competing with Vicodin for pain relief, is Lipitor. And of course, as many of you know, Lipitor, which is a registered brand name, anybody know what the generic name for Lipitor is? Atorvastatin. Now again, I'm not going to emphasize that you memorize lots of drug names, but there is now a generic available. And as somebody who actually takes that stuff, the Lipitor is quite expensive, and atorvastatin is a fraction of that price. We will be mentioning in a little bit that when drug companies develop a drug, the government, the U.S. Patent Office, allows them to have exclusive right to be the sole producer, manufacturer of that drug for 20 years. But after 20 years, then they open it up to anybody who wants to make it. Now, that's when generics become available. So any drug where there's no generics available, after 20 years, they allow generics. So anyhow, Lipitor is the #2 most prescribed drug, and what's it used for? Yeah, to lower cholesterol, and as we will see, this cholesterol business is really important because elevated cholesterol levels are believed to be the major cause. There's a wide consensus on this, but not everybody agrees. But the cholesterol levels are generally believed to be the major cause of both heart attacks and strokes. And heart attacks and strokes, heart attacks are the #1 cause of death, and strokes are the #3 cause of death. If you're wondering what's #2, cancer. So the #1 and #3 leading causes of death are both believed to be related to cholesterol levels. So we'll talk about that. So that's why so many people in the population are trying to lower their cholesterol levels. The #3 most prescribed drug, and again, I'm not asking you to remember this, is lisinopril. Anybody ever hear of that? Anybody know what it is? What it's used for?
Blood pressure.
Yes, it's used to lower blood pressure. It belongs to a class of antihypertensive drugs known as ACE inhibitors. And we'll learn what that is. Those are angiotensin converting enzyme inhibitors. So they work by reducing the renin-angiotensin-aldosterone mechanism, and that's how they lower blood pressure. And these ACE inhibitors, like lisinopril, are right up there among the most prescribed drugs And again, when we're talking about drugs that are widely prescribed, that means it's a very high probability that 1 out of every 10 or 20 patients is going to be on these things. And they're widely used. Atenolol, anybody ever heard of that? That's also blood pressure. It goes under a brand name Tenormin. This is the generic name. And atenolol is what's known as a beta-1 blocker. And we'll tell you what beta-1 blockers are. I have no doubt you've heard of them. The question is, what do they do? And they're used not only for high blood pressure, but also for controlling angina. And so we'll get into that. Number 5, Synthroid. What's Synthroid? So that's synthetic thyroxine. Very common. Thyroid problems are quite common and pretty common for patients, people who need to take thyroxine. Number 6 is amoxicillin. What's that? So that's a very widely used antibiotic. And we will tell you a little bit about antibiotics towards the end of this class, because I know that you've heard of penicillin G, penicillin V. Amoxicillin is a penicillin, and so is augmentin. And we'll try to explain the difference between penicillin V and amoxicillin and augmentin. They are all penicillins. If you're allergic to one, you're allergic to all of them, but they have a different spectrum of action. And we'll tell you a little bit about that. Hydrochlorothiazide, anybody know what that is?
Blood pressure.
It's also blood pressure. It's a quote, diuretic that's commonly used for blood pressure. Zithromax. You know what that one is? It's an antibiotic. It's actually an erythromycin. And in the older, it's not that old, protocol for giving antibiotics to somebody with a history of rheumatic heart disease, this was one of the drugs that was given as an alternative to people who are allergic to penicillin. So we'll get to that. Furosemide, you know what that is? That goes under a brand name Lasix. It's a diuretic, also used for high blood pressure. Again, I'm just throwing these out just so you... our interest is not memorizing drug names, but knowing what a calcium channel blocker is, or an ACE inhibitor, or a beta blocker, or a diuretic, so that when you hear the class of medication, you understand what it is and why that patient would be on it. Norvasc. You may know what Norvasc is. This is the number 10, one of the top 10 most prescribed drugs. Norvasc is a calcium channel blocker. And so we know some calcium channel blockers can cause enlargement of the gums. So they are very commonly used, these calcium channel blockers. Now, this was a listing of the most prescribed drugs by actual drugs. The lower list is a listing of the most prescribed drugs by class, by category. So if we were listing them by the class they belong to, the number 1 most prescribed drugs, class of drugs, are HMG-CoA reductase inhibitors. Now this is the number 1 category of drugs that are prescribed. Does anybody have any idea what the hell that means? Well, that's the actual class name for Lipitor. And all the other drugs, Zocor, Lipitor, Mevacor, they belong to what are called HMG coenzyme A reductase inhibitors. Because the way Lipitor and those other drugs work is they inhibit an enzyme in your liver. And this is the name of the enzyme, HMG-CoA. That's the name of the reductase. And so they inhibit that enzyme. The second most widely prescribed class of drugs are proton pump inhibitors. Anybody have any idea what a proton pump inhibitor is for?
Yeah.
Do you know what a proton is? Would it help if I told you that a proton is the same as a hydrogen ion?
Yeah.
So these are used for acid reflux. Does that make sense? You see, you remember a hydrogen atom? And so a hydrogen atom in the nucleus has 1 proton, and orbiting around it is 1 electron, right? That's a hydrogen atom. If it gives away that electron, now it's a hydrogen ion, and all that it is a proton. So a hydrogen ion and a proton mean the same thing, and so these are drugs that inhibit the production of protons, or in other words, hydrogen ions. So in fact, one of the brand names for a proton pump inhibitor is a drug called Protonix. Have you ever heard of that? So it's called Protonix. It's cute because all it's doing is affecting proton production, which is hydrogen ion, for acid reflux. The third major class of drugs that are prescribed are SSRIs and SNRIs. Anybody have any idea what that class of drugs are? Okay, SSRI, and once I tell you, you're going to know, it's a selective serotonin reuptake inhibitor, like Prozac and Paxil and Lexapro. So the Prozac type of drugs affect serotonin levels in the brain. So they are called serotonin reuptake inhibitors, or SSRIs, and sometimes serotonin norepinephrine reuptake inhibitors. So again, the idea is not to memorize drugs, but when you see that it's an SSRI, you'll understand what that might be. Obviously, you can always look it up. The problem is, you know what it's going to say in here? It's an SSRI. That's what it's going to say. Or it's an HMG coenzyme A reductase inhibitor. So that's what it's going to say. There are other antipsychotic drugs that come in number 4. Erythropoietins are number 5. And you'd say, what are erythropoietins? Anybody know? Yeah, erythropoietin is actually a hormone produced by our kidneys that stimulates the production of erythrocytes, or red blood cells. And it goes under the name Epicrit and Epigen. And this is given to people usually who have either kidney failure, because it's made by the kidneys. So if the kidneys fail, they stop making this hormone, and therefore they become anemic. Their red blood cell count drops. And they also prescribe it to people undergoing chemotherapy for cancer, because the chemotherapy causes anemia. And then the 6th class is seizure disorders. And then the 7th are anti-arthritic drugs, including COX-2 inhibitors. And an example of a COX-2 inhibitor, can you say, what the heck is that? Is Celebrex. Anybody ever heard of that? And this is a NSAID. Anybody know what an NSAID is? Non-steroidal anti-inflammatory drug. So there are lots of NSAIDs, and you probably, I'm sure, have taken them. Advil, Motrin, right, some have taken more than others. Aleve, okay, and Celebrex. So again, these are widely used, and we'll learn more about them. Antiplatelet drugs come in next. Can anybody think of an antiplatelet drug? Actually, warfarin is not an antiplatelet. It is an anticoagulant. But warfarin actually reduces the levels of prothrombin and other blood clotting proteins. But it doesn't affect platelet levels. That's what aspirin is. Aspirin is an antiplatelet drug. And not only is aspirin, but so is Plavix and Agrinox, if you've heard of these. So we will learn. I know that you've heard of aspirin, you've heard of warfarin or Coumadin, and you've heard of Plavix, and we'll tell you the difference between them. Incidentally, those groups of drugs are relevant to you, because anybody who's on any of them is a bleeder. Because all of these drugs interfere with blood clotting. And the reason why they're taking them is because blood clots are also connected to this idea of heart attacks and strokes. Those are thromboses, or blood clots. Either a coronary thrombosis, a blood clot in a coronary vessel leading to a heart attack, or a cerebral thrombosis leading to a stroke, a cerebrovascular accident, or CVA. Next comes calcium channel blockers, and then antihistamines. So this is just another way of classifying drugs. On the next page, so it looks like this, And the FDA, the Food and Drug Administration, is constantly adding and approving drugs, constantly putting warnings about drugs, and sometimes even withdrawing drugs that had been approved. So just as an example of this, I think some of you might remember a drug called Vioxx. Anybody remember that? Well, Vioxx is no longer available. Vioxx was in the same class as Celebrex. It was a non-steroidal anti-inflammatory drug that, because of increased risk of heart attack and stroke, they actually removed it. Another one was Rezulin. Rezulin was used to control type 2 diabetes, but they found that it was too toxic to the liver, and it's no longer available. Another drug, this is very famous in the world of dentistry, was Pondamin and Redux. This was known as fen-phen. Anybody remember the story of fen-phen that was used to lose weight, and it damaged the heart? And why that was important in dentistry is because when you damage the heart, it increased the risk of endocarditis and so on. And that's always of importance to be aware of increased risk of endocarditis due to streptococci infections, which are endemic to the mouth. Anyhow, so another one was Seldane that used to be used as an antihistamine. So these are no longer available. On the back side of this, these drugs are still available, but the FDA might remove them. And that includes Celebrex, and it includes Accutane. Has anyone ever heard of Accutane? So that's used for severe acne. But anybody who's used Accutane or knows about it, it is absolutely not to be given to a woman who's pregnant, because it is known to be teratogenic or cause birth deformities. It is acceptable drug, but it does have some potentially serious side effects, including increased risk of suicide and so on. Suicidal behavior can affect emotions. Meridia is another one that's been used for weight loss that they're watching. And again, there's some other drugs that they're constantly watching. Ceravent is a very important drug for asthma, and they're a little bit concerned about that one as well. These are still fine drugs, they're still available, but the FDA is monitoring them, so anything can change. What happens beginning on page 5 is a list of the top 200 drugs prescribed in the year 2006, and while I have some newer lists for you, what I like about this list is it lists the drug by brand name, it lists it by generic name, it lists its most common use, and it lists what class it belongs to. So just using the very first drug as the example, Lipitor, right, either the number 1 or number 2 most prescribed drug, is used for cholesterol treatment, and it belongs to this class called HMG, coenzyme A reductase inhibitor. The second one, Vicodin, which is hydrocodone and acetaminophen, also known as APAP, and that's used for pain, and it belongs to the narcotic analgesic class. So I like this because it gives you quite a bit of information very, very quickly. So that goes on for a lot of pages. Now, just in terms of a newer listing, you might say, well, don't you have anything newer than 2006? And the answer is, we're going to give you the listing for 2010. Obviously, we don't have 2012 because 2012 hasn't even finished. And they haven't yet made available the top 200 drugs for the last year, 2011. So the latest I've got is 2010. Our focus, my goal is that we have a handle on like the top 50 drugs that are most prescribed. So recognizing that there are hundreds, thousands of drugs, to be familiar with the top 50, the 50 most commonly prescribed drugs, I think is useful. Let's take a look at page A1. And on page A1, I want to give you a sense, not that I probably need to, of how complicated this drug stuff can get. And I know you could say, that's okay, I believe you, let's just get But, all right, so as you know, if you look at any medical journal, dental hygiene journal, they usually have a section where people can write in questions, and they will then have some, quote, expert in medicine or dentistry, dental hygiene, respond to the question, right? And most journals have that. So this goes back a number of years ago to the Journal of the American Medical Association, or JAMA, and this was where a doctor, Mark Bouchnard, MD, wrote in a question to JAMA, the Journal of the American Medical Association, describing a patient that he was treating, and he wanted some advice. So here's the background, and I'm using this as an example because the patient that he's talking about isn't that uncommon. A 60-year-old man has a long history of essential hypertension. All right, what's hypertension? High blood pressure. And he's being treated with a thiazide diuretic. In fact, as we will learn, one of the first drugs they commonly will try to control high blood pressure is a diuretic. Those are 80% of patients with high blood pressure can be maintained or controlled by a diuretic. A low sodium or salt diet, if you know of anybody with high blood pressure, you know they've been asked to watch their salt intake, and weight control. Recently, however, in this 60-year-old guy, he's developed adult onset diabetes, type 2 diabetes, adult onset, insulin-independent diabetes mellitus, that is fairly responsive to an oral hypoglycemic agent. Oral hypoglycemic drugs would be like glucophage or metformin. In other words, he doesn't have to inject himself with insulin. He's able to control it by taking an oral anti-diabetic drug. Exercise and diet control. Okay, so the guy has high blood pressure and he's developed late onset diabetes. Now, for the past few years, he's also suffered from mild to moderate anxiety-associated depression. This is also not uncommon. As people get older, they get more depressed. And where you really notice it is when they get into their 70s, because all their friends are dying. All right, that's a little depressing. Okay, and of course they got aches and pains and so on. So a lot of people start to take some antidepressant medication. A complicating factor is the presence of first-degree heart block. Now, the first three things are really common: high blood pressure, diabetes, and depression. All right, this is a little bit unusual. He's got first-degree heart block. Now, the diabetes, this doctor writes, might be in part the result of prolonged use of the diuretic. But I have not changed the antihypertensive medication to a beta blocker because of the heart block. Considering that methyl-dopa may be associated with depression, concomitant thiazide diuretic and oral hypoglycemic therapy can have opposing effects, and hyponatremic problems have been associated with hypoglycemic agents, what safe combination of drugs would permit effective treatment of this patient's hypertension, diabetes, and depression? In other words, they're starting to look at all this drug-drug interaction. Because every drug not only has its therapeutic uses, but it's got side effects. And it's starting to get more complicated. The more every medication they add starts making it more confusing about what's the underlying pathology and what are the side effects of the medication. Let me just read you part of the answer. I'm not going to read the whole thing. So here's an expert who, from the Cleveland Clinic. Cleveland Clinic is still a very top medical institution, if you haven't heard of it. He writes to back in response, "This patient illustrates well the complexities of individual situations and the difficulties of a cookbook approach to antihypertensive therapy. I agree that a first-degree atrioventricular block, as well as the patient's age, are relative contraindications to the use of a beta blocker. I'm not sure, however, that the thiazide diuretics interfere to a significant extent with oral hypoglycemic agents. The patient's diabetes is under fair control with this particular combination, and I assume that particular attention is being paid to avoid hypokalemia, since this condition may interfere with glucose utilization. All right, he just goes on, and they start to analyze this, and it just gets more and more complicated as they start to consider all kinds of different clinical facets. So we're not, obviously our goal is not to get into all the complexities of this, but to recognize drug-drug interactions, and any medication that a patient is on does affect the body, might even affect the mouth in some way. And that's why they want you to learn something about medications that patients are on. In a somewhat humorous vein, not quite as serious, on the back side, let's talk about the Mexican way. What is the Mexican way? This is appeared in a number of years ago in a news magazine, and it was an article about something called the Mexican diet. Now, the Mexican diet doesn't mean going out to, I don't know, a place, you know, what's the place, El Dorito or Torito in Marina del Rey, and having a margarita and El Torito. So, what was the Mexican diet? It says it's cheap and effortless, and some overweight folks believe it works wonders. Okay, now what is the Mexican diet? So here's what it is. It's where you cross the border and you go to a place called, let's see, where is it? Nuevo Laredo, Mexico. And there they have a clinic where they give you Rototex. Now what is Rototex? All right, it's made only in Mexico. Wow. And it's essentially contains stimulants like norpseudoephedrine and amphetamine and triiodothyronine, which is a thyroid hormone, that together boost your metabolic rate. So you're on stimulants like speed and synthroid. Each pill also contains Valium, right? And a laxative, which makes you go to the bathroom, and atropine sulfate, which deadens the taste buds. So you're not going to care about eating so much if you don't taste, nothing tastes like anything. Now, it's usually prescribed once daily with another form of speed called Ponderex, also made only in Mexico, and Modiuretic, a diuretic. So it takes pounds off fast. Yeah, I would think so. You're basically on two types of speed. You're on synthroid, thyroxine. You're on a diuretic, a laxative, and you've numbed the taste buds.
What else?
Yeah, what else? But you could start to see, my gosh, what are you doing to that person? All right, so this is, again, and so this is not a prescription. These are not prescriptions. This is somebody choosing to go to Mexico where they don't have the kind of regulation of drugs that they have here, and basically taking something that would never be approved in the U.S. Related to this is we have more and more patients who go on the internet and they buy all kinds of stuff on the internet. And they take all kinds of herbals and so on. Some of the herbals probably don't do anything. Some of the herbals may have some effects, and maybe not necessarily positive effects. So it's getting more and more complicated as you have patients on more and more prescription drugs, and even more and more all kinds of other stuff that they're taking. Sometimes they don't even tell anybody that they're taking these things. So that's the challenge. On page A3, right, so this course is called Pharmacology. What is pharmacology? It is the scientific study of drugs. The root pharmaco means drugs. That's what pharmaco means, and ology means study of. And it involves the study of drugs, their sources, their chemistry, and their uses. Now the question is, okay, pharmacology is the study of drugs. What is a drug? What is a drug? It's a very broad definition. It's really any chemical. It's any chemical that affects the body. A chemical that affects the body. Well, that's pretty broad. So in other words, not only would it include prescription drugs and over-the-counter drugs, it would even include herbs, which affect the body. It would include vitamins and minerals, which affect the body. So really, and even foods, which affect the body. So in fact, that helps explain why the government agency that regulates drugs is the FDA, the Food and Drug Administration. Because it's a very broad category of what can affect the body. Any chemical that affects the body is potentially a drug. Now, we're going to develop this. Pharmacology is really based on the understanding of two major things, physiology and biochemistry. And so that kind of explains how I got into this, because I was a physiologist in my education and degrees, and that's really the foundation to understanding how these chemicals affect the body. Now, as far as subdisciplines of pharmacology, so the branch of pharmacology that everybody's heard of is pharmacy. Now, pharmacy is kind of interesting. Pharmacists really know drugs. They should know it better than any physician or any dentist. They spend 4 years just learning drugs. They don't have to learn how to fill cavities. They don't have to spend any of their time learning surgery or diagnosing disease. All they have to do is memorize drugs. So they really do know drugs. Ironically, even though they know a lot, and they expect them to know a lot, in practice they do very little. In practice, they are more like secretaries. In practice, they dispense drugs. They count out pills. You know, here's 25 pills, here's 30 pills. And they keep records for the government. That's really, they're record keepers. So they are really in charge of dispensing drugs. That's their main actual goal. Now, the reason why they ask them to learn all about drugs is so, in theory, a patient could ask them a question and get a knowledgeable answer. But in fact, all they really do is keep legal records. They dispense drugs and keep records. Now, there is a branch of pharmacology called pharmacokinetics. Now, pharmaco means drug. Kinesis means movement. Movement. Kinesiology is the study of body movement. If somebody's hyperkinetic, they're moving a lot. So pharmacokinetics is the movement of a drug through the body. It's how a drug moves through the body. And we commonly divide how a drug moves through the body into 4 phases. Absorption of the drug into the body, distribution of the drug through the body, the metabolism or breakdown of the drug, and finally its elimination or excretion. So those are the 4 phases or facets of pharmacokinetics, of how a drug moves through the body, how it's absorbed, distributed, broken down, and eliminated. Now, what is pharmacodynamics? Pharmacodynamics is how the drug works, what effect it has on the body. So this is really the effects of the drugs on the body and its mechanism of action. So how does the drug work? Does it inhibit an enzyme? Does it block a receptor site? Does it bind to something else? Does it compete with another chemical in the body? So that's really called, that study, that analysis is called pharmacodynamics. What is toxicology? Now toxic, the root toxic means poisonous. Toxicology is the study of the adverse effects. Adverse means harmful. What are the harmful effects on the body? So pharmacognosy, we had just said, was this study of the botanical, which means the plant sources of medications, and they used to search all over the world for possible herbs that might be a source of new drugs. But increasingly, in the modern times, they basically study physiologically how the body works. We discover receptor sites. For example, it wasn't that many years ago where they discovered serotonin receptor sites, endorphin receptor sites, gamma aminobutyric acid or GABA receptor sites. And then they develop medications that activate or block these receptor sites. And that's increasingly how we develop drugs. So most drugs today, new drugs, are totally man-made, totally synthetic, and not obtained from botanical sources. All right, the next topic is actually a really good, important topic to have some knowledge of. And that's drug nomenclature. Nomenclature, as I think many of you know, means naming. And so how are drugs named? Part of the biggest confusion of drugs is all the confusing names, because they go by multiple names. So there are really three names. There's the generic name, there is the brand name, the trade or brand name, and on page A4, there is the chemical name. Let me go through each of these, and then we'll give you some examples of what we mean. Now, unfortunately, even these names, generic and brand name, have multiple names for that. The generic name is also known as the non-proprietary name. Non-proprietary means it doesn't belong to anybody. And it's also called the official name. So the generic name, the non-proprietary name, or official name all mean the same thing. And this name, this generic name, is actually chosen by the government. The government is what gives the drug its generic or official name. And as I'm going to show you in just a moment, this official name is this generic or official name is always followed by the three letters USP. And USP stands for United States Pharmacopoeia. And before you ask me, well, how do you spell that? Let's take a look at page A9. So we're going to see page A9 and tell you what we mean. So on page A9 at the bottom, so on the bottom of page A9, it's talking about the sources of information on drugs on page A9. And the very first source of information is the United States Pharmacopoeia, or USP. Now, the United States Pharmacopoeia is the official listing of drugs for the United States. United States Pharmacopoeia, the kind of like encyclopedia of drugs. And this is the official listing of drugs that are legal in the United States. The first time that the USP was ever published was in 1820. You certainly don't have to know that. But today, this sets the standards of quality, of purity, of packaging and labeling of all drugs that are legal, that can be dispensed in the United States. And the name by which they call the drugs in this publication put out by the U.S. government is called the official name or generic name. And it's always followed by the letters USP. I'm sure you've seen those three letters, just didn't know what it meant. All right, so let's go back to page A3. So back on page A3, so the generic or official name, a name given by the U.S. government, is always followed by the three letters United States Pharmacopoeia, USP. Now, the trade name, or proprietary name, or brand name, or registered name, this is the name given by the manufacturer of the drug. The manufacturer of the drug comes up with their own cute little name. And only they have the right to use that name. It's not selected by the government, it's selected by the company that develops the drug. And they copyright that name, they register it with the government, and so that's why it's always got this little symbol, the R in a circle. That R in a circle is called the registered or brand name. It is owned by the manufacturer of the drug. And they commonly, when they name these drugs, they like to make them very memorable. So they will give them cute names, and they are typically 3 syllables. Now, for those of you who've studied music, 3 syllables reminds us of what's called a triplet note in music. And so the vast majority of brand names have 3 syllables. There are many exceptions, but we'll show you some examples of what we mean. Now, one correction. the manufacturer, when they develop a new drug, has the exclusive right to make this drug, and they changed this not that long ago from 17 to 20 years. So whoever develops the drug first, the government gives them exclusive right to sell that drug, and nobody else can make that for 20 years. Used to be 17. And the whole idea is to give them an opportunity to make a lot of profit, to compensate them for the research and development, the R&D costs of developing that new drug. So they want to, the only way a company is going to spend millions and hundreds of millions, sometimes billions of dollars to develop a drug is if they have confidence that if it works, if it's a success, they'll make lots of money off it for their shareholders and so on. So the government says, we'll give you 20 years, and after that, though, anybody can make that drug. This is under the federal patent law. Okay, on page A4, the chemical name. Now, we will, in this class, I will make reference to generic names and brand names. I will rarely ever talk about the chemical name. But the chemical name, for those of you who took a course in organic chemistry. So if you took organic chemistry, you remember you had to go and write like 1,3,5-tri-methyl 2,4-dioxy, and it just goes on and on and on, and you had to count for every single carbon and hydrogen and OH group on that molecule. That's called its chemical name. And that chemical name is given using the rules of drug naming or nomenclature by IUPAC. And I don't know if anybody remembers IUPAC. Don't worry, I'm not going to ask you who IUPAC is, but it stands for the International Union of Pure and Applied Chemists. So one thing about that, when you see that really, really long name, that really tells you where every single atom of that molecule is. So you can't fool them. And sometimes some drugs just differ from one another by just an atom or two of where they're located. So that's the chemical name. We will rarely talk about the chemical name. Here's some examples of what I've just described. There is a drug called epinephrine hydrochloride, USP. That is the generic or official name of a drug. We call it the generic name. It's also called the official name. That's how it's listed in the United States Pharmacopoeia. That was given by the government. Now, there are many, many brand names of it. The most famous brand name of epinephrine is adrenaline, with an R in it, a registered brand name. Now, there are a whole bunch of other brand names. Epinal, EpiPen, Epitrate, EpiN. So how come most of you, if you've heard a name, how come the name that you probably have heard is adrenaline? Because for 20 years, there was only one manufacturer of epinephrine in the United States. It was Parke-Davis Pharmaceutical, and they were the first developer of epinephrine, and they called their brand of epinephrine adrenaline. So for 20 years, at that time it was 17, there was only one manufacturer for all those years, and that was Parke-Davis. Today there's lots of competitors. The chemical name, which all of you who know organic chemistry can enjoy figuring out, is 3,4-dihydroxy-alpha-methylamino benzyl alcohol hydrochloride. All right, so we won't use that. Now another example, aspirin, USP. That's how it's listed in the United States Pharmacopoeia. That's its official name or generic name given by the government. The most famous brand name is Bayer aspirin. They just called it aspirin back in those days. Bayer was the very first manufacturer of aspirin. Today there's also Ecotrin, Emperim, Norwich, St. Joseph, all kinds of brand names of aspirin. The chemical name is acetylsalicylic acid. Now you do sometimes run into this, and they will abbreviate it ASA. So if you run across, and in fact in the hospital setting, nurses commonly will write, instead of writing out the word aspirin, they will write ASA, acetylsalicylic acid. Just like I mentioned earlier today, that they would use APAP to refer to acetaminophen, which is the chemical name. Another example, ibuprofen, USP. That's how it's listed in the United States Pharmacopoeia. The very first manufacturer of ibuprofen in the United States was Upjohn Pharmaceutical, and they called their brand of ibuprofen Motrin. And that's why that's the most famous brand of ibuprofen. But today there's Advil, there's Excedrin, there's Nuprin, there's Pamprin, there's Rufin, there's a whole bunch of brand names of the very same ibuprofen drug. Its chemical name is 2-para-isobutylphenylpropionic acid. Lidocaine, hydrochloride, USP. How many times have you noticed that? All right, so that's USP, that's how it's listed in the United States Pharmacopoeia. That's its generic or official name. The most famous brand name of lidocaine is xylocaine. Why? Because Astra Pharmaceutical was the exclusive manufacturer of lidocaine for 20 years. And then their patents ran out, their exclusive right, and now there are many other brand names: Dowcaine, Lidoject, Nervacaine, Octacaine, and a whole bunch of others. Here's its chemical name. One last one: propanol hydrochloride, USP. So propanol hydrochloride, the most famous brand name of it is Inderal. It was produced by the Aorist pharmaceutical company for Inderal. Notice 3 syllables, Inderal. And their brand name, they were the exclusive manufacturer of propranolol for 20 years. That was a beta blocker. That was the very first beta blocker. It's still used. But today there are many, many other brands of it. And there's all these generics. CVS has generics of everything, you know, that they can, where it's legal to. For you organic chemists, you can have fun naming this molecule. This is propranolol. It's 1-isopropylamino 3,1-naphthoxyl 2-propanol hydrochloride. Brings back fond memories, right? Not fond memories, okay. Memories. Okay, that takes us to page, where are we here? A5. And so on A5, let me begin the subject, I don't know how far we'll get, on drug laws. And you might say, why am I going to talk about laws? Because they give you some background as far as the history of drugs. The very first federal law, and I'm not asking you to know, the very first federal law to ever be passed by the U.S. Congress pertaining to drugs was the 1906 Food and Drug Act. And it basically set up some rules pertaining to interstate commerce. So notice what I'm saying. I'm not asking you to remember this. There were no federal laws pertaining to drugs before 1906. None. You could do whatever you wanted. In 1914, the Harrison Narcotic Act, I'm not asking you to know it, this required anybody prescribing a narcotic had to be registered with the federal government. Before then, you didn't have to register with the federal government. You just wrote out a prescription. Now, the law that I do want you to know is letter C, the 1938 Federal Food, Drug, and Cosmetic Act. In 1938, this is where the federal government really gets serious about regulating medicine. Under this 1938 law, the Congress created the FDA. There was no such thing as the Food and Drug Administration before 1938. And this was the regulatory and enforcement agency under the U.S. Department of Health to regulate drugs. It required that new drugs be tested that they're safe. What does that mean? Before 1938, there was no law that you had to prove that a drug was safe. It prohibited fraudulent therapeutic claims. Before 1938, the manufacturer of the drug could claim anything they wanted, and there was really no enforcement. It required proper labeling, and it established the United States Pharmacopoeia as the official listing of drugs that are approved to be dispensed in the United States. Just before we go further, just to give you a sense of what I mean, take a look. Let's see if I've got this here. No, I didn't include. Okay, let me just mention a couple of things. Before 1938, there was a product called Hofstadter's Bitters. You don't have to know this, but there was a product called Hofstadter's Bitters. You don't have to know this. Now, Hochstetter's bitters. You're saying, what kind of crazy name was that? This was Dr. Hochstetter. Dr. Hochstetter, that's a person's last name, and it was called Hochstetter's bitters. This was a product where Dr. Hochstetter sold this stuff before 1938, and he said it would cure arthritis, and it would cure dropsy, it was good for congestive heart failure, it was good for tuberculosis, it was good for everything. You can use this basically any problem you had, you just took this stuff. They analyzed what was Hochstetter's bitters after 1938. It was whiskey. So he was selling whiskey, claiming this would make you feel better. Well, probably did. All right? But it didn't cure anything. So with the 1938 law, they could not sell Hochstetter's bitters. They could sell it as whiskey. They couldn't sell it as a medicine. All right? Another one, Mrs. Winslow's soothing syrup. Now, what was Mrs. Winslow's soothing syrup? Well, this was sold to put on the gums of infants who were teething, right? Where the baby teeth are erupting, and you know how babies cry? Because it hurts? So you just rub this Mrs. Winslow's soothing syrup on their gums, and it helped.
It was whiskey, right?
It wasn't whiskey, it was opium. Oh. That would have helped, right? You were rubbing opium resin right on that, so that helped. But they didn't think it was a good idea to give, an 8-month-old, put opium on their gums. So, 1938 law, they can't sell Hochstetter's bitters and Mrs. Winslow's soothing syrup anymore. Oh, if you look on the next page, A6, I did include this. Look at this. This is on page A6. This is dated 1910. And this was an ad in a news. Look at this. Cancer can be cured. And this guy, Dr. Johnson Remedy Company. Look at that. Dr. Johnson Remedy Company of Kansas City, Missouri. He's going to send all the sufferers of cancer these 2 big books absolutely free to prove that you could just cure. We can't cure cancer today. He could do it in 1910. Now, obviously, this is called fraud today. Quackery. So they can't get away with it. They could until 1938. After that, that's the importance of that law. Now, back on page A5, in 1952, there was an amendment to this 1938 law called the Durham-Humphrey Amendment. And it's worth knowing something about this one. This is what established in 1952 2 categories of drugs and how they would be dispensed. There were legend drugs and OTC drugs. This was established in 1952. A legend drug is another way of saying prescription drug. It requires a prescription from the prescriber, from the physician or dentist. And then there's OTC, over-the-counter drugs that do not require a prescription. Now, why did they call prescription drugs legend drugs? Because anytime you get a prescription drug, there is a label, a legend, that says federal law prohibits the dispensing without a prescription. You ever seen that written? That is a label written on every prescription drug, and it requires that label. So it's saying it's illegal to dispense this drug without a prescription. So the government decides, the FDA determines which drugs require a prescription and which drugs do not. And basically they require prescriptions for drugs that they feel are either more dangerous, a person might overdose, they have very severe side effects that the person should be aware of. So they regulate some drugs that can only be dispensed by prescription. Other drugs like Tylenol you can take over the counter. Okay, 1962. This is an interesting law. This law, very important, required extensive testing. So all new drugs required very extensive testing to see if they were safe. And this is the law that required that all new drugs be tested on 2 animal species before they can do clinical studies on humans. So anytime they develop a drug, they first study it usually on mice or rats, and then they may choose dogs or monkeys, And then they have to do that to find out they're safe on those species before they allow them to test on humans. And they'd also require testing on possible effects on a fetus, and so on. So before 1962, they did not require all this extensive testing of a drug in order for it to be approved. This had an interesting consequence. Again, if you look on the next page, A6. On A6, this graph, I'd like you to notice, this is the number of new drugs, And notice in 1940, 1950, 1960, everybody see how the number of new drugs is increasing and increasing? And then look what happens around 1960, 1962. Can everybody see that the number of new drugs approved by the FDA plummets? Because they are going to require massive amounts of documentation that a drug works and that it's safe. Now, because of this law, this is why many drugs are not available in the United States, even though they're sold and available in Mexico, in Canada, in Germany, and so on. And people will go they will go to Canada, they will go to Mexico to get these drugs, they will go on the internet and purchase these drugs. So is this a good law or a bad law that it required such extensive testing? Well, some people would say it's a bad law, but the FDA thinks it was a good law, that it required extensive testing. And the best argument for the FDA of why it was a good law, and I'll write it out, thalidomide. Anybody ever hear of thalidomide? Now, if you had me for anatomy, you heard of thalidomide. Anybody remember what the story of thalidomide is?
The babies that were born differently, I don't know.
All right, so I'm going to tell you about thalidomide. Thalidomide was introduced in the late 50s and early 60s. It was available in most countries of the world. It was used widely in Britain, in Canada, in Australia, in Germany, and it was a drug for morning sickness. What is morning sickness? Most women, when they get pregnant, at least for the first 3 months, sometimes the entire pregnancy, they experience nausea. They become very sensitive to smells, and just the very smell of many things in the morning just starts causing them to, start to throw up. Very common. In most women, it goes away after the first 3 months. So this drug was developed to reduce nausea, morning sickness. But the manufacturer never tested its effect on the fetus. And there were tens of thousands of babies born with birth deformed arms and legs. They were known as the thalidomide babies. Tens of thousands. This drug was never approved in the United States because of this 1962 law. This kept this drug out of the United States. The manufacturer wanted to market here. The FDA said, you've got to document what effect it has on the fetus, as well as everything else. And the manufacturer says, we're not going to bother. We'll sell it in Canada, we'll sell it elsewhere. We're not even going to bother with the United States. And that kept thalidomide out. Now, just to tell you a little bit more about thalidomide. So if you can come right here, let's see, right here on my website. Let's